You must be thinking, maybe you're in high school, maybe you're in college, maybe during the application process of CRNA school, and you're thinking, will CRNA school be the same as nursing school? When this video, I'm going to let you know the real deal and definitely tell you what the hardest part is about the differences between them both. So definitely keep watching. My name is Christine and welcome to a new video. If it's your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. Just want to say thank you for being a part of this CRNA Thrive CRNA family. I'm very thankful to have you here to be watching these videos. It's not for me, it is definitely for you. And being a part of this family, I'm here to give you as much information as possible and definitely share your experience in a comment below in regards to your nursing versus CRNA school experience if you are currently in CRNA school. There are definitely many differences when you're thinking about nursing school versus CRNA school. However, in my opinion, I feel nursing schools lays a foundation to the nursing field in general, because you got to remember, when you become a CRNA, you got to remind yourself you are still a nurse. You are a certified, registered nurse anesthetist. You are focusing more on anesthesia practice. So, and of course, you are an advanced practice nurse. But as a nurse, you need that foundation of nursing skills, especially when you graduate nursing school and now you become a nurse in the ICU, for example, or depending on where you're at right now, maybe you're in another area. Being a nurse lays that foundation for you to be able to be a part of patient care, having that holistic approach in medicine. So yes, CRNAs are, of course, practicing a little bit differently in regards to anesthesia care compared to nurses, but always remind yourself that you need to have nursing under your belt to become a CRNA. To go through my experience, when I was in nursing school, I have a different perspective. For me, yes, nursing school was difficult for me. Of course, it's not a walk in the park. As a nurse, you have to learn everything about nursing, all different specialties of nursing. It's not just focusing on pediatrics, not just focusing on the adult population. You're learning everything about nursing and all different age ranges, as well as medications, patient population, comorbidities. You're seeing it all. To prepare yourself so when you graduate, you can go into any area you're really interested in. Now, the schoolwork is, in my opinion, it's hard and it is challenging. But when you think about CRNA school, it is on another level. In my opinion, you have to be on the same skill set, education, as well as mindset. You have to be able to work autonomously on your own. 95% of CRNAs in rural areas are basically sole anesthesia providers. So for example, you might be a CRNA working in a rural hospital, in a specific area, and you might be working on your own. So you're the only anesthesia provider at that institution. You may not have as many cases. And for example, if a situation comes where it becomes very difficult or a patient needs to be transferred to a more of a bigger hospital, you have to make those decisions on your own. As well as if you have a patient that's very difficult, basically, not that you're on your own, you may have the help, of course, your staff, because you got to remember this too. Yes, you're a CRNA and you're taking care of patients, but you have respiratory therapy, you have the nursing staff, you have the auxiliary staff, you have the surgeon, you have doctors, you have people available to you, as well as, depending on the institution, you may have someone you can contact to help with your decision making. You may have someone help give advice, maybe a CRNA from maybe you have friends who are CRNAs in other areas, and you can actually call each other and ask each other questions. But at the end of the day, the decisions you make is your own, and you have to make that choice. So that definitely can be difficult for some people to be on their own fully, but as a CRNA, and when you graduate CRNA school, you'll definitely be able to, in my opinion, depending on your experience, of course, to be able to work on your own. But for me, I love where I work. I love the model I work. I'm more of a supervision approach where I'm working currently, and I work with CRNAs as well as doctors, anesthesiologists, and I'm very happy with my work environment. I love people I work with, and I love my model. But everyone's different. Some people want to be more autonomously, which is fine, while others want to work in a team approach. So that's always something you have to consider when you're thinking about, being a CRNA. Now, nursing, for example, a nursing school, it's different. You'll be working, as a nurse in an institution, depending on whatever area you want to be in. But, there's a delegation model. And of course, you have to always, speak to a doctor and make sure, of course, double checking your orders, for example. But you'll be working under, a facility, under doctors making those decisions for you, as well as, of course, depending on the setting you're working in, like in the ICU or the ER, you make more autonomous decisions, as well as working with the team approach. So it all depends on that when you're thinking about nursing compared to certified nurse anesthetist. Now, I still remember when I was in nursing school and learning a lot of the information for the first time, and it was definitely difficult, A lot of the concept was new for me, even in nursing. So definitely take that into consideration. But then also remind yourself that if you can get through nursing school, you can definitely get through CRNA school. Yes, they're different, but if you work hard and you don't give up and you just keep at it, as well as making sure your clinical experience is strong, make sure that you are, keeping up to date on best practices, as well as keeping your mindset focused on making sure critical care and your knowledge base is up to date, trying to be active in your institution, going to conferences, taking certification exams, keeping yourself up to date. Those things can help you as a nursing student, transitioning into being a nurse, going into CRNA school, and transition to being a CRNA. It's all about that. And also, yes, you might be thinking to yourself, my grades, how important is that? Yes, it's very important. You have to do well in school. So some school, they may say a 3.0 GPA or a 3.5 GPA, and maybe your GRE might be waived. Just remind yourself, it is going to be different. Now, also CRNA school and the skill set you're going to learn is going to be on another level. I felt when I was in nursing school, yes, I got good clinical experience, and also I learned a lot. But when I graduated from nursing school and became a nurse, I felt like it was difficult, like the transition, like being on my own, as well as being a nurse. I felt like, in my opinion, I don't feel I was prepared. It was more like decades ago, of course, older now. But looking back, I just didn't feel like my experience and being on my own really gave me that when I graduated and became a nurse. But the nice thing was, when I was a nurse and I graduated, I was a graduate nurse, and I got the opportunity to work at NYU Langone, and I was in a teaching institution. And it allowed me to really get that experience to allow me to be a really good ICU nurse. I went right into the ICU when I graduated. So if you have the opportunity to go into the ICU now, if you're a graduate nurse, definitely put your comments below. Or if you have the opportunity to go into a nurse residency program, definitely tell me your experience or what's your status on that on the comments below. So yes, you might be thinking to yourself, for example, for me, I definitely went right into the ICU and I got that experience. So my ICU experience and the institution I worked at and my experience may be different from you. And the ICU experience that I got, as well as the residency program I was involved in, allowed me to become a strong ICU nurse. And I felt my transition, my first 6 months to a year, was amazing. I felt I learned so much. I grew. And yes, I had a rocky road in the beginning because of course, natural things that happen. You may have issues with preceptors. The environment may not be the most conducive to learning. And I definitely have a video on that, so definitely watch that video. But I definitely, didn't give up. And I didn't let others affect my decision. I always stayed in tune with myself, because I knew what my journey was going to be. At that point, I wanted to become a nurse practitioner. Now I'm a CRNA. Things change, things happen. But I knew that I wanted to continue my education. I knew that I wanted to be involved. I knew I wanted to do more than just working in the ICU. I did research, which I loved. I definitely was a part of my community. I definitely was a part of committees in my hospital, as well as, of course, being a part of the code team. I just continued myself on, as well as go back to school. even taking classes to become a nurse practitioner, I felt, yes, I'm a CRNA now, but I'm very excited that I got that experience to be in college and get graduate studies under my belt to figure out what I wanted to do. So yes, things change, but I felt that actually prepared me, in my opinion. Taking graduate classes allowed me to get my mindset, kept my mindset continually growing with school, because naturally when you become a nurse and you're working on a floor, and if you're not in school, for example, sometimes you lose some of that study taking techniques, writing papers, and definitely with exams, how to like really maximize and do well with exams, because it's all a tactic, and as you go to school, you learn different tactics that work. And I definitely have videos on that as well, so definitely check those out, because you want to be able to be a strong student, when you're in nursing school. CRNA school, there's no difference. I feel like a lot of these techniques that I've learned throughout the year has allowed it to be much more of a easier transition. And I felt I've learned the techniques to allow me to be successful in school. So no matter if it's nursing school, CRNA school, it's going to be a road depending on you. Maybe you're an art student and now you're taking classes in biology or chemistry, statistics, and you're like, this is all new to me. So definitely, yes, it may be a harder transition for you in nursing school versus another person who maybe have a biology degree. So those are things that you got to take into consideration when you're thinking about nursing school versus CRNA school. But definitely, CRNA school for me was on another level now. Now, transitioning from having my ICU experience, it definitely allowed me to lay a foundation. It allowed me to be a strong student. So, like I said before, I was in nurse practitioner school taking classes at NYU, which was great. So it helped me because some of the classes I took actually was accepted. So definitely my workload my first semester was much lighter. Still was heavy, but I definitely had one or two classes that was taken off, because a lot of times, depending on the school you're going to, it's a lot of like base classes that you need to take for everyone. So it definitely helped me in that sense, which I feel helped me in the future, so it definitely helped me transition when I was in school. It allowed me to focus really on, specifically anesthesia related classwork, the basics of anesthesia, which I got 100% attention on. And for me, my experience was a little different, When I was in nursing school, I didn't have a child, it was just me and school, which allowed me to be, I feel, easier transition. Versus when I went to CRNA school, I had a newborn baby, 6 days after I had my beautiful baby girl, Bella, I went right into CRNA school. I still remember wearing a donut in school, to sit and wagging around a suitcase. It costs us tons of books that you need to have. And it was definitely hard on my body because I just had a beautiful baby, but my body is still transitioning from having, a baby. And of course, my family dynamic, my husband and I, having to transition, having a baby and being in school. It was hard. It was tough. But you know what? I never gave up. I never let anyone tell me that I couldn't do it. Yes, people have their mindsets and they have their opinions, and that's fine. You listen to it. You don't get upset. You just listen to it and you just accept what they're saying. And then, not accept it, but you just listen. But then at the end of the day, you make your own decisions because you know yourself better than anyone else. There are going to be people in nursing school, for example, or in the ICU or in CRNA school that's going to try to put you down. And you have to say to yourself that, yes, everyone has their opinions and you have to respect that, but you got to make your own decisions and your own decisions in life. And you got to say to yourself, yes, people may say this, that, and the third. I can't go to school. You can't go to school having a family. You can't go to school with, having a newborn baby. You can't go to school because of this and that. You got to say to yourself, you know what? Yep, they have their opinions, and I'm thankful that they care, or maybe they don't care. But you have to make those decisions for yourself. And if you say you have these dreams, no matter your age, maybe you're in your 40s, your 50s, your 60s, and you say, so I want to become a CRNA, and this is what my goal is in life, you do it, no matter the situation. And you may say, wow, nursing school is so hard. And yes, I've heard CRNA school is 10 times harder. Yes, that might be the case for you versus someone else. But if you want to become a CRNA, you shouldn't let anyone stop you. If you have to retake certain classes to get better grades, maybe you have to be more active on your unit. Maybe you have to switch from labor delivery and go into the ICU. Maybe your clinical experience was difficult for you, and now you have to transition and you have to stay focused. Yes, you got to do it because you want it bad enough, and that's how I feel. And these are just my opinions, but you have to follow your dreams and your path. You got to stay, keep hungry, like you want it. You want to stay hungry. You got to stay motivated. You got to stay inspired, because I'm here to inspire you, and I'm here on YouTube to inspire you to do what you want. And it may not even becoming a CRNA. It may become a nurse practitioner. It may become an educator, which we need educators out there. It might be, something different. But I'm here to say to you that yes, if you want something bad enough, you can do it. You just got to stay motivated. And you have to say, I want to be here to allow you to thrive in whatever you want to do. So no matter if it's nursing school or CRNA school, yes, in my opinion, it's much harder. And clinical experience will be much harder. But you can do it. You just got to stay at it. You may have some days where you're sweating. You may have emotional moments. You might feel like, can I really continue? But with anything, even when you became a nurse, for example, and you in your first 6 months to a year, it was hard, but you kind of get used to it. You kind of get used to the punches. You kind of stay strong, and it becomes easier as you continue to become a novice to an expert. And so same thing happens. You're going to be a novice in school again, and then you can become an expert. So. And every person is different, and every person has different lengths of where they're going to become that expert, and that's normal, and that is fine. So yes, just remind yourself that nursing school is going to be hard. CRNA school is going to be 10 times harder. But at the end of the day, if you have the strategies and the tactics to be successful, which I'm here to give to you, I think that you can do it, no matter what. I'm here for you. And so definitely comment below, what are some things you're thinking about that feel like it's going to hold you back if you decide to go into nursing school, become an ICU nurse, else maybe even CRNA school? Definitely put those information below. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thanks for watching.